Chapter 1 provides a brief introduction to clinical phonetics, a little bit like the overview lecture that I posted for the first week. Provides information about articulatory and acoustic phonetics, talks a little bit about different dimensions of clinical tasks that can affect performance, and it also talks about different ways that speech production gets evaluated clinically. Phonetics is defined as the study of the production and perception of speech sounds. Sub-areas include articulatory phonetics, that looks at the articulation of speech, and acoustic phonetics, which studies the physics of speech sounds. So, for example, for a speech sound like t, it's articulated by making a closure at the alveolar ridge with the tongue blade. In terms of anatomy, that typically involves raising the jaw, raising the tongue body, and raising the tongue tip, using muscles like the masseter and temporalis for jaw raising, the mylohyoid, the posterior genioglossus, and the transverse muscles for tongue body raising, and the superior longitudinal muscle for tongue tip raising. The acoustic result of a t sound is silence followed by an aperiodic transient. More specifically, there's an abrupt onset of noise from the silence above about 4,000 Hz frequency, and we can also see formant transitions on the vowels on the basis of place of articulation. All of those technical terms don't make much sense to you until you take speech science, where things like aperiodic, transient, formant frequencies are all defined. We can evaluate speech production and speech perception in a variety of ways. If we look at the development of language, perception necessarily has to come before production. Little babies hear the speech around them before they start to try to mimic it. The perception side falls primarily under the field of audiology, though there are some connections to speech-language pathology in the field of oral habilitation or rehabilitation. The evaluation of speech production that we can do has different degrees of levels of detail. So in this class where we do clinical phonetics, we'll evaluate production through our perception of what was produced. In the speech science class, you can evaluate production using various types of measurement instrumentation, whether that's acoustic instrumentation, which is what is used most often, or whether that gets into articulatory instrumentation as well, though articulatory instruments have been used less so far in the field of speech-language pathology. The perceptual and instrumentation analysis of speech are somewhat complementary. Looking at speech with instrumentation can help reveal differences that are difficult to perceive. On the other hand, instrumentation can also help our perceptual evaluation. If we make a recording of some speech that we can listen to more carefully, we have a better chance to accurately note what's being produced compared to if you just try to listen to it live and do it on the spot. So the focus of this course is perceptual evaluation, and a certain amount of what we're going to do in this class might be called ear training, getting you good at perceiving the sounds of speech that are produced so that you can evaluate speech to different levels of detail. So at the broadest level, you can look at correct versus incorrect. With a little more detail, you can look at what the difference is between what was produced and what should have been produced. And then last but not least, phonetic transcription using the International Phonetic Alphabet is an attempt to make an accurate recording of what was produced. In evaluating speech production, the ability to produce a speech sound is not absolute. Even I, as an adult speaker of the language, will make some speech errors while recording all of these presentations over the course of the semester. When looking at the development of speech sounds in little kids, the threshold where a kid's considered to have mastered a speech sound is often set at 80% success. So if they can produce it correctly 4 out of 5 times, they are considered to know that ability. That ability to produce a sound successfully can also depend on context. So there can be certain contexts where the kid is able or unable to produce a speech sound. The speech production task that you're evaluating can also affect ability to produce a speech sound or success in producing it. So we have less complex tasks like producing just a single sound, like saying S. We can have a slightly more complex task like producing that sound in a word. And within a single word, we might also look at that sound in different positions, like at the beginning or at the end of word, or in different phonological structures, like inside of a consonant cluster or in a stressed syllable. We can take that up another level of linguistic complexity to look at sentences or phrases, so that sound produced in a group of words that are strung together. And then finally, of course, you could have a whole sequence of multiple sentences, and you could look at the speech sound produced in there. So at the word level, looking at the T, we have a whole bunch of different examples, like T with the sound at the beginning, try with it in a cluster, stay with it in a cluster, hit with it at the end of the word, post at the end in a cluster, bats at the end in a different cluster, atom in the middle, a tone where it's in the middle but it's at the beginning of a stressed syllable, unlike atom. We'll go into all of this detail of linguistic structure as part of what we do in the class this semester. Doing perceptual evaluation of speech can also apply to a variety of different types of tasks. So you could say something and have the client repeat it, be it a sound or a word or a sentence. So you give them an example and they repeat it directly. You could have someone read aloud words or sentences. There are various ways of eliciting spontaneous speech without giving someone a specific script. So for example, you can show them a picture of a scene and ask them to tell a story. And you can also observe what's going on in discourse. So for a child, for example, putting them in a play session, or for an adult client, having just a general conversation with them and noting their speech production. Even in some of these less structured tasks, clever task design can help you focus on particular speech targets. So for example, we might make a play area for a kid with toys in it that focus on the T sound. So there could be things like trains and tracks and trees and trucks and trails, where that T sound is in a cluster with R in all of those different words. Or something like a train, a top, a cat, a cart, some water, where the T sound is in different positions in different words. So if you have little toy objects in that play area, you can ask the kid to name things or tell them to pick up certain things, and then try to have a discussion about them. From the clinician side, the complexity of the response that you're evaluating can affect how easy it is to evaluate. So if somebody is producing just a single sound, you don't have to pay attention to a lot to be able to understand whether or not they produced it correctly, for example. If you put that sound in a word, well, then there's other potentially distracting sounds around that might make evaluating that sound more difficult. If you put it in a string of multiple words, well, then there's even more to keep track of. If you put that in a sentence and worry about bigger than a single sound units, like the presence of stress or focus in the sentence, that can make your evaluation more complex. So for example, if you were interested in the A vowel, a sentence like "The rain in Spain falls mainly in the plain" has 4 different A's in it. If you were going to have to judge whether they were produced correctly, you'd have to keep track of that for each of the 4. That's a case where having instrumentation to help might be useful. If you make a recording and can listen to it later, well, then you can focus on the individual items. The detail to which we do an evaluation also affects how easy it is to do. So the book talked about these different categories of a two-way evaluation, judging whether something is just correct or incorrect versus an expected production. This is relatively easy, but there is the question of what is the expected production supposed to be. That production may not be the same as your production if your client speaks a different dialect of English than you do, for example. You judge something as correct if it sounds right. If something is incorrect, there could be a variety of ways that could happen. So one example that I saw was a kid talking about a Samsung tablet and using Snam Snug for Samsung. So the expected Samsung was not produced correctly. A five-way evaluation has something as being correct or containing one of four different sound error types. There could be a deletion where a sound isn't produced that should have been. There could be a substitution where a different sound is produced than the one that's expected. There could be a distortion where the production sounds odd in some way, but it doesn't sound like it's some other sound. Or there could be an addition where you produce an extra sound. So in the case of Samsung being produced as Snam Snug, we have an addition. In both cases where there's supposed to be an S at the beginning of a syllable, we get a SN instead. And then there's also a substitution. In case of having the ng at the end, that velar nasal, we get the G sound instead. Last but not least, our evaluation can be a full transcription with the International Phonetic Alphabet. This alphabet is similar to English spelling, but it is, to a linguist, considered a true alphabet where there is one symbol per speech sound. In the case of IPA transcription, most of the letters are the same as English spelling, especially for the consonants. When we go through and do a transcription, however, we still have some options as to how detailed we can make our transcription. So generally, we will start doing broad transcriptions, which have about the level of detail of spelling, and also a level that matches your perception in terms of your knowledge of the English language or any other language you happen to be fluent in. We also have a narrow transcription, which attempts to capture more detail, and for most people this requires some additional training to be able to identify these details of articulation or extra bits of the acoustics that don't just match our perception of speech sounds in the language. So for example, for a word like pasta, we have two different vowels in there, despite them both being spelled with the same letter in English spelling. The slashes show a broad transcription of that word where we've captured the individual speech sounds. Inside brackets, we have a narrow transcription of that word where there are extra symbols like a raised, almost apostrophe-like thing that indicates stress, a superscript H, which indicates the aspiration of the initial P, a almost colon-looking thing after the vowel, which indicates that's a long vowel. So I will try and use slashes versus brackets to differentiate broad versus narrow transcription. If you go and look at other people's transcriptions or read books, there's a lot of variation in how people use these different symbols. Sometimes linguists use this for a distinction between a phonemic transcription, which is more of a phonological or abstract transcription, versus a phonetic transcription that's meant to capture what was actually said. So either slashes or brackets around a set of letters indicates a transcription. Whether the writer of that transcription really meant something by their use of slashes versus brackets is not always necessarily clear.